My name is Perko. I'm a pediatric hematology and oncology doctor at Essentia Health. So I specialize in childhood cancer and blood-related disorders, so not just cancer, but benign hematology, things like sickle cell disease, bleeding disorders, but also treat patients with brain tumors, solid tumors, leukemias, and any type of cancer or thing that falls into that diagnosis area. To me, that's an important thing because these patients are chronic patients. We see them for a long time, so we get to know them very well, and that's something as a physician that I value. People come to see us or come to see me because they either have one of these diagnoses, like cancer or a bleeding disorder, or there's concern that the patient has it. That's actually a lot of what we do is rule out these diagnoses, and that's very important. You positively impact a patient when they have a diagnosis. You help treat that disease or treat that illness. The other thing is there's a lot of fear that goes into a family who comes in thinking they have a diagnosis and they don't. They see the word cancer or they Google something and fear like, this is what I know about cancer, and you're worried about your loved one or your child having it. So a lot of what we do is, when the disease isn't there, is just treat that fear and take care of the family with their questions and concerns. And for me, communication is really important. So when a family leaves here, I want to make sure that they understand what we've talked about. I want this to be a very parallel conversation where we work together and that families can be comfortable asking questions. Medicine is teamwork, and we have an amazing team here that covers all aspects of our treatment. So we have doctors, we have absolutely wonderful nurses, both inpatient and outpatient, that work to take care of our patients. There's a lot of continuity, so the patients get to know the caregivers that they have. The most fulfilling part to me is the trust that a family gives me. I don't take that lightly. It's changed so much after being a parent. I did all my training not as a dad. I was a husband, everything else, and then you hold your son for the first time, and then later your daughter, and you realize how much a parent loves their child. Until you felt that as a parent and you realize that trust and that bond and just the appreciation that you have for the people that care for your child, and something that I'm really honored to do. And I grew up 60 miles north of Duluth, so when a patient comes in and they say, I'm from this small town, you've probably never heard of it. And I'm like, oh, I know people from that small town. There's a special thing of, you're serving your community that you grew up in, and these are little kids that could be you or could have been you. That's a neat thing.